huge distinction between chiropractic and active release techniques. Chiropractic, by definition, is to do by hand. So it kind of is a gray area there as far as what's involved in chiropractic. It could be from mobilization of the spine, it could be applied kinesiology, and various different levels. Last time I heard there was 129 different ways to mobilize a spine. So there's a lot of diversity within inside the chiropractic model. But it all goes back to mobilization of a motor unit or a segment to free up a nerve so that there's no disease process that begins when the nerve or the tissue becomes fixed. So when the vertebrae is malpositioned or it's out of place, chiropractically you align that vertebrae to allow that nerve that traverses out of it to function properly. Now, chiropractic is very successful at doing that. It's probably the #1 treatment for low back pain is chiropractic adjustments. Where chiropractic stops is with the muscle, tendon, and ligament and the fascia. Chiropractic does not treat that aspect. So something like active release techniques, which is the active movement of a muscle, tendon, or ligament under a contact, frees up those fibrous adhesions that have developed in the tissue, muscle, tendon, and ligament, and fascia, due to an injury. So a good way to picture this is picture a paintbrush and picture all the bristles of the brush, and then picture them being adhered together or leaving that paint in the brush, and all those fibers start to stick and adhere. Well, obviously you can't use the brush anymore the way that it was intended. So where active release comes in is that it's the tool, which is primarily my thumbs, that break up those fibrous adhesions in that brush and allow you to use that paintbrush again. Now, that could be a rotator cuff, which are 14 different muscle groups, if you will, in the rotator cuff. It could be the low back, where there's several different scenarios in regards to what could be causing low back pain. But chiropractic by itself addresses a very specific particular type of symptoms. Adding the active release allows you the diversity to treat almost anything. So the difference is chiropractic treats osseous bone misalignments, and active release treats the muscle, tendon, ligament, and fascia. So we like to talk about it as, what do we have in our golf bag? Originally, when I went to chiropractic school, I had a club in my bag called chiropractic, which would be mobilization of the bone. I added active release to it, and now I had muscle, tendon, and ligament. So as you start to add these different modalities to your bag of tricks or to your golf bag, you end up with an array of clubs. So in addition to just the chiropractic, we have the active release. We also do a functional movement screen and pattern. That once you've mobilized the area and the tissue is free from the bone is free to be able to function the way it should, and you have the soft tissue component to where the fibers are no longer adhered, where that paintbrush has been corrected, you now must create a pattern in which to fix the bad pattern that led to the condition in the first place. So you have the chiropractic portion where you free up that joint. And you have the ART portion where you free up the muscle, tendon, and ligament, making sure it's functioning properly. And then you add a functional pattern of correction, which is the actual pattern that the tissue should be functioning in. And that makes the results permanent. So once we treat the patient, mobilize the spine, do the active release, right pattern, and we have a kind of a motto or a philosophy. Go long means free up the tissue, go strong means create the pattern, and then go hard. And that's when we find the athlete in every person. And we bring back that athleticism in our patients, because the more that you put some strain onto the tissue, the more the patient is going to respond. So we try to put our patients in as much physical activity as we can to create that permanent result.